Well, good afternoon, everybody, and welcome to GPA Live. I'm your moderator, Ron Aaron Eisenberg. Delighted to be here. GPA Live is the virtual education series brought to you by the Global Pain Association. We've got a great show for you today. If you have arthritis, and millions do, or you think you have arthritis, you're going to want to stay tuned to today's GPA Live. According to the Centers for Disease Control in the United States, 23% of all adults, or more than 54 million people, live with arthritis. That's 1 in 4 adults. It's a leading cause of work disability, with annual costs for medical care and lost earnings of over $303 billion. That's serious money, not to mention the pain and the anguish that goes with having arthritis. Today, we'll be visiting with Angie Billingsley with the Arthritis Foundation of Texas. She's a myth buster, and she's going to bust many of the common myths associated with arthritis. But first, today's GPA Live is underwritten by our friends at ACOG.
If you are an older, a veteran, or disabled, the Alamo Area Council of Governments is here for you with various services,
including assistance for mortgage and rent, groceries, medication, and even legal assistance. And if you live in one of the 12 counties surrounding Bear, these services, including public transportation, are also available to you.
And the Alamo Area Council of Governments is here to help. Please call the Alamo Service Connection today or visit their website for more information.
I want to introduce Dr. Susan Blackwood, who is president of the Global Pain Association, who had the concept and is the driving force behind GPA Live. And Susan, it is great to see you. Welcome to GPA Live. How are you doing?
We're doing fine. What a busy week with school starting for many of our kiddos, and a lot of anxiety with parents, etc., sending the kids back. But we're going to promise to be safe, and we're all behind this together. And I want to thank ACOG for being a sponsor. They have so many services that people don't know about that we could probably do a segment every week with just an ACOG service that they have that are available to people in these 13 counties. So thank you to them for being a sponsor. We appreciate their support. And with sponsors like that, that's how we can keep the series going. Global Pain Association started in 2018. We had an in-person seminar, and since that time we've pivoted beginning March of 2020, and now we've reached over 80,000. So it's been phenomenal. Organizations like the Arthritis Foundation make this all possible for us because they bring us experts. And I want to, at this time, thank Dr. Penn Wickersham from our board, who brought the Arthritis Foundation and awareness of their organization to us. And I know it's going to be a great session today.
Well, I know when you say pivot, I think of that great segment from Friends. Pivot, 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 pivot. Moving the big couch, if you hadn't seen it. So Susan Blackwood, thank you. We will talk to you at the end of Angie's presentation on arthritis. And my guess is you'll be taking notes.
Absolutely.
I want to introduce now Angie Billingsley. She's with the Arthritis Foundation, and she's been in nonprofit management for more than 17 years, currently serves as the Senior Executive Director and the Interim Central Region Vice President for the Arthritis Foundation. In addition to managing activities in Central, South, and West Texas, Angie oversees the staff in Dallas, Houston, New Mexico, Oklahoma, Detroit, Indiana, and Wisconsin. Think about that on a map. That's a heck of a territory to cover. She and her husband relocated to South Texas from Midland in 2016. Angie has a 25-year-old son who still resides in Midland and a 27-year-old daughter who is traveling as an ER and trauma nurse. And Angie Billingsley, it's really great to have you on. When you lived in Midland, did you hang out with the Bushes?
No, sir, did not. There's no bushes of any kind. Bushes, no trees. No.
Other than the former president and governor, right?
I knew what you meant. I was trying to make a funny, but maybe
it's
too early on Saturday.
No, that's true. Not a single bush in Midland. That's right.
Yes, sir. Tumbleweeds. That's about it.
Oh, wow. So talk to me about the Arthritis Foundation and what attracted you to dealing with something that affects so many millions of people.
Sure. Well, initially, I didn't realize how many millions of people it affected and impacted. I believed I guess we could call it the myth, right? That arthritis was something that affected only the elderly population, or something that maybe we would all get as we aged. And I didn't realize the scope and the impact to our country that arthritis has on 54 million adults.
And there are a bunch of myths.
Yes, sir. Lots of misconceptions, myths, untruths, and a lot of times just unawareness about the realities of it. So I'm really pleased to be here with the Arthritis Foundation. They were founded in 1948, so we've been really leading the way for the arthritis community for over 7 decades.
And when you think about myths, this is not a myth. If you happen to be in our chat room, we'd encourage you to not only ask a question if you have one, but to share this program so that others can join in. We have over 80,000 folks who now participate, and we encourage you to share this widely so that others can join in. And our guest today, Angie Billingsley with the Arthritis Foundation, based here in San Antonio, but every single state has an Arthritis Foundation. Angie, with over 100 diseases under the arthritis umbrella, that's a whole lot more than I would have ever thought.
Yes, sir, absolutely. I don't think that the general public realizes all of the different forms that fall under the arthritis umbrella. So most of us are very familiar with the degenerative type of arthritis, like osteoarthritis, and that's the one that's most commonly, commonly known as we get older and our joints start to, degenerate. That's the osteoarthritis, or OA. But there are also the autoimmune diseases like rheumatoid arthritis, psoriatic arthritis. You have your lupus and your gout, fibromyalgia, all of the different disease types that you see here. But one of the most unknown is juvenile arthritis, and that children do get arthritis as well.
We have a friend whose daughter at a young age developed rheumatoid arthritis, and it's tough enough if you're an adult to deal with. Imagine for a kid.
Absolutely. I just talked to a newly diagnosed, the mother of a newly diagnosed child this week, 2 years old, and just diagnosed with a juvenile idiopathic arthritis. So
we've had somebody join us now in the chat room, Elizabeth, who says she's struggled with lupus and arthritis all of her life. Her joints hurt and they're swollen.
Absolutely. One of our board members here in San Antonio suffers from rheumatoid arthritis and lupus. And so she's been able to take advantage of the Arthritis Foundation and some of the resources and services that we have to offer, and has just become an amazing advocate and volunteer.
Now talk to us about arthritis itself.
Sure. So it's definitely more than just a little pain. So I'm sorry to see Elizabeth there in the chat that she's struggling with the pain and the swollen joints. But it is more than that. It is our country's #1 cause of disability. It is the second largest driver of employer healthcare costs. 1 in 4 Americans, including working Americans, have arthritis and live and work every day with chronic pain. 90% of those 54 million say that pain interferes with their day-to-day activities. It's also the cause of 172 million missed work days annually. And as you can see there, $304 billion in total medical costs and earning losses each year in our country.
So I guess for folks who are just tuning in, if you're not aware of it, arthritis is much, much bigger than any of us ever thought.
Absolutely.
Now, how are we doing when it comes to arthritis? When you look at some of the impacts on people, this slide talks about how they feel.
Sure. I know that mental and emotional health have been really in the forefront of a lot of conversations lately. We have what's called an insights assessment, where people with arthritis can go on and rate not only their pain and their quality of health care, but also their mental and emotional health. And based on these results, there's some shocking statistics here that are very concerning. The fact that 50% of people with arthritis feel regularly fatigued, 58% feel like nobody understands how arthritis pain affects them. 2 in 3 have felt anxious or fearful over the past week. and 71% often feel depressed. So we see, unfortunately, these sort of statistics a lot because arthritis is an invisible disease, right? And you can't, well, maybe some signs may be evident to see maybe someone with rheumatoid arthritis in their hands, or as we get older, there may be some deformities, but most of the time it is an invisible disease, and people don't understand the level of chronic pain that that people with arthritis experience daily.
Yeah, you don't wear a sign, there's nothing on your forehead that says, hey, I'm in pain.
Exactly.
Now, talk to me a little bit about some of the facts involved in arthritis. And then I've got a couple of myths I want to throw your way. Give us the
Sure.
facts, just the facts, ma'am.
So these are a few facts that I think were surprising to me when I first heard about them. So the fact that there are, we mentioned 54 million adults in our country, but in addition to that, over 300,000 kids with doctor diagnosed arthritis in our country. But there's only 445 pediatric rheumatologists. So
That's for the whole country.
yes, sir. So if you do the math on that, it's evident that we have a severe shortage of pediatric rheumatologists in our country. Many of our kids are having to travel very far to see their pediatric rheumatologist. We do have one pediatric rheumatologist in San Antonio, but rumor is that he is getting ready to retire, which will leave us with no pediatric rheumatologist here in San Antonio, meaning that our local kids in this community will have to start traveling far to see their doctor. So that's
Now talk to us,
shocking.
Angie, talk to us a little bit about why it's important to have a pediatric rheumatologist. Isn't arthritis, whether you're an adult or a child, or are there differences in treating children?
Absolutely differences, with being so many different forms. I believe there's over 25 different forms of juvenile arthritis. So whether it's juvenile polyarticular arthritis or juvenile idiopathic arthritis, all of the different forms, and it does manifest itself differently in children. There are some children that are diagnosed as young as age 6 months to 2 years. You could get diagnosed as a teenager. So definitely it is a completely different specialty to be a pediatric rheumatologist. And this is one of the things that we really focus on when we talk about what does Arthritis Foundation fund and where does the money go that we raise. So we do really focus on pediatric rheumatology fellowships and paying for those fellowships for any of those incoming physicians that choose pediatric rheumatology.
That's pretty cool. This next fact really shocked me.
Me as well. So of course we know that the risk of arthritis does increase as we get older, but 2/3 of the people with arthritis are actually under the age of 65.
Wow.
So it does affect people at all ages. And I just had a young man, 41 years old, last week get diagnosed with osteoarthritis. So it doesn't just happen once we hit that 65 mark.
And then physical activity. This is another surprise.
Sure, it does limit physical activity more frequently than heart disease, cancer, or diabetes. In addition, we know that some of these other subsets of diseases like heart disease, diabetes, even obesity can often lead to arthritis. But ultimately, the pain that people live with arthritis does limit their physical activity more frequently than you would think.
And children with arthritis, huge.
We talked a little bit about that, yes, sir. But I think that it was shocking for me to find out that in our country, there are more children with doctor diagnosed arthritis than cerebral palsy, muscular dystrophy, and juvenile diabetes combined. Wow. So it's not something that gets a lot of attention. It's not something we hear a lot about, but it is definitely a disease that is impacting the children in our country.
And it truly impacts veterans as well.
It does. So we talked about 1 in 4, right? 25% of our country has arthritis, 1 in 4. But in our military, both active duty servicemen and women and veterans, the statistic is 1 in 3. So it's higher prevalence in the military, and it is unfortunately one of the top 2 reasons that our servicemen and women are deemed unfit for duty and forced to be discharged or to retire early.
Yeah, you mentioned when we did a rehearsal the other day, think about having a 100-pound pack on your back and leaping out of an airplane, what it's like landing with all that weight on you.
Absolutely. That's one of the things. So we do partner very closely with the Department of Defense, and we do fund research with the Department of Defense to identify additional ways that we can support our military and veterans with arthritis. We also recently signed a national partnership with the U.S. Department of Veterans Affairs to start doing some connect groups and identify some very specific resources and services for our veterans.
All right, now we've covered a couple of myths. I want to throw one out at you very quickly because we want to do a little myth busting. So Angie, and I heard this growing up, cracking knuckles will cause arthritis. My mother would say, Ronnie, if you crack your knuckles, you're going to get arthritis.
Well, I can't speak to any other health risks that it may cause, but I can tell you that as of today, it is not scientifically connected to arthritis. So research may change that down the years, but as of right now, there's no scientific connection between the two.
And then the other one, I'm sure parents who have children who have arthritis will hear from relatives, friends, and neighbors, well, look, the good news is children outgrow arthritis.
And unfortunately, that's probably not true. Now, children can go into remission depending on the type of arthritis, right? So if they have juvenile idiopathic arthritis, probably will not, right? If they have juvenile rheumatic disease, probably will not. That's what eventually turns into rheumatoid arthritis as you get older, even though it's still always called juvenile arthritis, right? If you're diagnosed when you're 15 with juvenile rheumatic disease, and you get older, people say, oh, you have rheumatoid arthritis, but they're still considered to have juvenile arthritis. So I have met a couple adults that were diagnosed as children that have been in remission for a while, but she still will always have arthritis no matter how long the remission lasts.
Now, we've talked a little bit about all of the impact of arthritis, the numbers of people who have it. Share with us what the Arthritis Foundation and Association can do to help people.
Sure. We have a lot of great resources. We do have a helpline that is available, a 1-800 number that people can call. It can be found on our website at arthritis.org. They can email helpline@arthritis.org if they have questions, if they need help with connecting to healthcare resources, maybe help with prescription medications. We have a great, amazing online community that's led by healthcare providers. They can get on and ask an expert. It's staffed by hundreds of people and experts across the country. Locally, we have connect groups, which is what we call support groups. But oftentimes, as we think back to the slide that showed the effects on mental and emotional health, oftentimes we hear people say, I just want to talk to someone who understands, right? We had someone earlier say, they are living with lupus and chronic pain. We have people that we can connect them with to just talk to someone that understands what they're going through. In addition to that, we do have lots of fun activities for our juvenile arthritis families, including JA Summer Camp. We do local JA Family Days where families can get together and meet other families living with the same things they are. We do local patient education events. And we also partner very closely with our local healthcare providers, and we provide free patient education materials to doctors for them to then give to their patients. So we work locally with many rheumatologists, with orthopedic surgeons, with pain specialists. So that's just the tip of the iceberg of a few of the resources that we offer.
Now, we know parents who have kids with arthritis often are cash strapped because of the cost of medication and services their children need. How can they afford to send their kids to an arthritis camp?
Well, that is why we do the amazing fundraising events that we do, because it is no charge to our families. None of the services, it is 100% free. for JA Camp, JA Family Day, all of our patient education events, anything that you ever register for. We have a free pain ebook that you can download for free that talks about managing your chronic pain. We have an app you can download that's free that is a kind of a goal setting app to help you set goals around your pain. There's no services that we provide to any of the families we serve that there's a cost associated with.
We should link that pain ebook with the Global Pain Association website.
Yes, absolutely.
Now you've got a fundraiser coming up, the Jingle Bell Run. I had mentioned to you off the air that my friend Barbara Morales and I, when we were both on the radio, co-hosted the Jingle Bell Run for several years in a row. And then, of course, it ended, but it's back, bigger and better than ever.
We are so excited this year. This is one of the events that we do that helps us raise money to pay for all of the services that we offer at no cost to our families. So Jingle Bell Run was the very first festive holiday run ever in our country. So people can dress up like an elf or like Santa or the Grinch or whatever they want to dress up as and come out, and you can run the 5K or you can walk the 1 mile walk. It is a certified, chipped, timed event. So for those serious runners out there, there is an opportunity to get a chipped bib and get your time for the 5K. We're also really excited because this year we're doing something a little different. We're bringing Central and South Texas together. So families that we serve, corporate partners, community partners, we're bringing them together from both San Antonio and Austin together this year. And instead of separate events, we wanted to do one big Central and South Texas run. It'll be there at Landa Park. If you're familiar with Worst Fest in New Braunfels, that is where we'll be. And that happens on December 11th at 3 o'clock.
And if you take a look at that QR code, what happens if people go to it?
Yes, that is where you register for the event. So it is normally $35 to register for Jingle Bell Run, but we have early bird pricing going on through the end of the month. So it is $5 off. If you register, that does get you entered into the event and your chipped bib. And it also gets you your t-shirt. So there is an event t-shirt and a goodie bag. And it's just going to be an amazing day to get to come out and meet other people. And as you said, Jingle Bell Runs are going on all across the country. So if anyone happens to join us that is not close to Central or South Texas, you can certainly just go to jbr.org and find the closest event to you.
jbr.org Jingle Bell Run.
Yes, sir.
Now I clicked on the QR code that's on our screen right now, and boom, up popped all the information. So it truly works.
Yes, sir.
Now, what haven't we asked you about arthritis that you can share? And here's your contact information as well.
Yeah, absolutely. I think one thing to note about the Arthritis Foundation is that we are volunteer driven. So we are not very staff heavy. I am the only staff person for all of Central, South, and West Texas. And so our volunteers are what keep us going. So talking about Jingle Bell Run, we have an amazing committee that plans the event and really works really hard to make this a great event. We have a local leadership board that really helps us achieve our mission goals around, are we reaching enough families? Are we reaching enough healthcare providers? And are we providing great services? So we're always looking for people to either join our local leadership boards or to join a committee, or maybe even just maybe like a community outreach committee that we have that reaches out to newly diagnosed families and welcomes them and makes sure that they're aware of the resources that we have available to them. And
you're always looking, in addition to the events, to raise money. Donations are accepted as well.
Yes, sir. Absolutely. They're vital, especially after, the impacts of COVID. I know they've impacted everyone and certainly impacted the Arthritis Foundation as well. So any donations are very much appreciated.
One last comment from our chat room. Marvin says he's been in orthopedics for the last 22 years and had no idea that many kids had arthritis. So there's somebody working in the healthcare industry.
Yes, sir. We hear that a lot. And that's one of the reasons we so much appreciate being able to do things like this today, is just to spread that awareness and help people understand really what a large scope problem this is.
Well, Angie Billingsley, Arthritis Foundation, we really, really thank you for joining us today on GPA Live. Look forward to talking to you again.
It was my pleasure. Thank you. Have a great rest of your weekend.
Thank you. You too. Today's GPA Live, by the way, is underwritten by our friends at ACOG.
Cuando me quedé cuidando a mi esposo, no sabía con quién ir. Los servicios de proveedor de EICO me brindaron las herramientas para seguir cuidando y ayudando a mi familia. Y ahora el programa Álamo Regional Transit, EICO está ofreciendo viajes a los sitios de vacunación gratis. Si es mayor de 60 años y si ha sido afectado por el COVID o si vive en una comunidad rural y necesita transporte, no espere, llame hoy.
God, we really appreciate your support, which gives us a reason not only to talk with Dr. Susan Blackwood, but to emphasize that you can help as well. Dr. Susan Blackwood joins us again. She's the founder of the Global Pain Association, and it is great to have you back on. We talked earlier about the Global Pain Association. Susan, ACOG, one of our sponsors, makes a big difference, but you could use more sponsors.
Oh, absolutely. Donors and sponsors are what keeps this organization going. And these segments week after week, thanks to you and the Eisenberg Group, are able to produce. And I was hoping that when we talked to Angie today, that we would know more about children and their involvement in arthritis. And more people should want to give to the organization as a result of us being able to reach all age groups. Our demographics have skewed a little bit on the older side and more women, but we reach out to everybody, men and now young people or people with young families that are affected by arthritis. And I'm so glad she was able to share that with us.
And it is amazing when you think about how many kids are involved, and yet a lot of those parents feel like the Lone Ranger.
Absolutely. But organizations like Global Pain and the Arthritis Foundation, we're here to help people. We're a community resource, and we want to be able to increase our reach, increase the people that are able to get information from these experts that come on week after week. And we can't thank them enough for volunteering their time, as well as our board and our advisory council for Global Pain, volunteering their time. And it takes a lot of time to put organizations like this together and these segments together. If you've got ideas, people out there watching, they can get on the globalpain.org and at info@globalpain.org. Let us know what other sessions you'd like coming up, because we're going to continue this during the fall. Our board has voted to have this during the fall, and hopefully at some point we'll be able to have another hybrid session or session in person when things are a little bit more safe and accommodating.
Well, we're delighted the board has made that commitment to continue these programs. We reach over 80,000 people every week. That's not insignificant.
It's not, and it's taken a lot of work and a lot of concern and effort on the behalf of the people that have been helping us. And so I can't thank them enough. And hopefully people will share this. Let people know that on our website and our Facebook page, they can watch any of these segments anytime, because they're there for an eternity.
That's great to hear. Susan, thank you. I really appreciate you.
I was hoping we might bring Miss Billingsley back on. Is she still in our back room?
Is she in the weight room? I don't know. Let's see if Angie's still around. There she is. Susan wanted you to come back by popular demand.
Yeah, always. I had to take a call, so I was wondering, did you talk about your app?
Yes, I did briefly mention the app. Yes, the pain app. It's, if you search in the App Store for VIM Arthritis Foundation or VIM Pain app, the app will appear there. And certainly people can reach out directly to me as well, or go to our website if they would like additional information on the pain app.
Well, I wanted to give a testimonial that I've gotten on that app, and I think it's wonderful. I appreciate you sharing that with us. This collaborative between Global Pain Association and the Arthritis Foundation is going to continue. And with your help and with your board and our board, we're going to make wonderful things happen for people that are out there suffering.
Well, we are honored to be associated with Global Pain Association, and thank you for all that you do for our communities across the country. And it was really, again, our honor to be here today.
Well, Angie, you did a great job. Susan, thank you very much. Let me share what's coming up next week on GPA Live at noon, right here on Facebook Live. We'll be talking on August 21st on GPA Live, the protein carb balance, a cooking demonstration with Dr. Marianne Pinkston and Sonia Jackson. And that will be very, very interesting. In our own family, we're trying to eat more protein, less animals, and a lot more plant-based foods. So we'll get a little help on that next week. Thank you to the Board of Directors of the Global Pain Association for making this broadcast possible, and to our executive producer and director, happens to be my wife, Gina Galaviz Eisenberg. Thank you for all your work on this. I'm Ron Aaron Eisenberg. We'll talk with you soon right here on GPA Live. Have a great weekend, everybody.